Menopause is a natural phase in every woman's life, but it comes with a range of symptoms that can be quite challenging. So whether you're experiencing hot flashes, mood swings, or sleep disturbances, there are various treatments available that can help. Family physicians, however, play a crucial role in educating patients about menopause, its symptoms, and treatment options. They provide support and guidance, helping women make informed decisions about their health and well-being during this transition. Today on our podcast, we will be exploring with a family physician some of the most effective options in the treatment of menopause. So don't go away, stay tuned. Welcome to the Help We Need podcast, where we explore topics that empower women and support their well-being. I'm your host, Fumike Murunkeji. Today, again, we will be going a step further on the topic of menopause.
So another risk that we talk about is blood clot or venous thromboembolism. Now, this risk has to do with the estrogen component of HRT, and it's only a slight risk. And I'll put it into context as well. The risk is higher in the first year of use. After the first year of using HRT, the risk is minimized or nullified. And the risk is higher with certain preparations, like the oral preparation of estrogen has that slightly increased risk. Whereas if you go with a patch, that risk, because the way the body metabolizes the medication delivered as a patch, that risk is minimized. But there are also other personal medical problems that increases the risk of a woman getting a blood clot from HRT. So that's if the woman has a personal or family history of blood clot, or if the woman is obese. Even obesity in itself carries an increased risk of blood clot. Now, also another risk that we talk about is the cardiovascular risk. And also, again, this has had a lot of controversy, but the summary is that if a woman uses HRT to manage her menopause symptoms early on in menopause, then the benefit she gets with HRT from the cardiovascular point of view outweighs the risk. However, if a woman starts HRT later on in life, let's just say above 60, because around that time changes would have normally occurred in the human body, then at that time, if the woman starts the HRT later on in life, the risk of the cardiovascular risk from HRT now outweighs the benefits. So I hope that helps people to put things into context. But then, like I said again, not everyone will go for HRT. Not everyone is eligible or suitable for HRT. So the non-hormonal treatments that have been recognized to be of help are antidepressants, namely SSRI, selective serotonin receptor inhibitors, and the other class of SNRI. There are different medications in this group that are called, namely fluoxetine, citalopram, paroxetine. Even though they are primarily antidepressant, there has been evidence to show that they help with mood swings, and they also help with hot flushes. But something to hone in on this area is that if a woman has breast cancer and she's on a medication called tamoxifen is a medication that a woman takes to reduce the risk of a reoccurrence of breast cancer. So in this group of women, taking certain antidepressant or certain medications like fluoxetine and paroxetine is not advisable because they reduce the efficacy of tamoxifen that they're using. Other medications that are non-HRT that have been shown to also have benefit with hot flushes are medications like gabapentin and pregabalin. They're essentially used to manage convulsions, but they're also used to manage nerve type of pain, but they are also very good in terms of helping with hot flushes. There's also clonidine also, which also gives women some relief from hot flushes. But also just to notice that most of these other medication, the most things that they help in to manage in terms of symptom control is hot flushes and mood swings. But every medication has a risk. It's just trying to decide what helps and what suits a woman better or best.
Thank you. You've said quite a lot. Using medical terminologies that I'm not sure I'll be able to repeat, but I'll try my best to summarize what I think I picked from what you've said. So again, we're speaking to hormone replacement therapy and the controversial topic of it as a treatment option. And what I hear you say is whether it's an hormonal treatment or non-hormonal treatment, all treatments, life itself has risk, right? So different treatments would always have risk options or indications, or it will present itself in different ways to different women. And I think in the beginning, you called that out to say, even when women do come to the clinic or the hospitals to complain about menopausal symptoms, you go through their personal history, you check their medical conditions, are they on any treatments? And these things are very important for doctors, obviously, to prescribe, to make sure there are no contraindications, if I'm getting this right. The drugs are not reacting in a contraindicative way to harm the patient. So it's important that you have that understanding of the history of the woman. I know there are a number of things you talked about just to demystify this perception. And you've talked about even certain, I would say, conditions such as obesity, excessive use or drinking of alcohol, and even where women have blood clot conditions. This also could present as risk and could be contraindicative when they're, given hormonal treatments or even non-hormonal treatments. So I think that's helpful to note. So I hope our women do understand that the doctors are always the first point of call. And I know, again, like I've said on most of my podcast, as women, we love to compare notes. We love to talk about, what worked for me and what worked for them, what worked for my mom. And, we can go on and on. And I think that's probably not a good approach. I think it's just us really focusing on our own health status, our own biology, how our body reacts to things will definitely be different from how another woman's body would react to certain drugs and treatments. So just being a bit much more centered and focused around ourselves and asking the doctors to guide us. And I'm sure when they share those insights, like you've made us understand, when we have questions, we ask questions. We're in the 21st century, right? So information is not so far away from just scrolling and searching the internet. So if we do have questions, I think it's important that we ask you or doctors those questions so that at least you can guide us accordingly. And I think this is really very helpful. So thank you so much for sharing all those information you've shared with us around the terminologies and what have you. So now moving on to, I know you talked about vaginal dryness as part of the symptoms for menopausal women. And I think this is a major concern, right? A lot of women have around this symptom for obvious reasons, especially for women who are sexually active or who have partners or who are married. So what do you typically recommend for patients, that they opt out of HRT, that is the hormonal replacement therapy, and decide, I don't want to do that? What would be how would you support them? And to women who have this symptom particularly, is the gynecologist always the first point of call? Like, okay, you have this symptom, go to the gynecologist, they'll sort it out for you. I'm just trying to understand, also for the sake of women, just to be curious in addressing this sensitive symptom, if you allow me say.
Yeah. No, thank you very much. A GP, general practitioner, or family physician is still the first port of call for women with vaginal dryness. And what occurs with vaginal dryness is that symptoms such as discomfort, pain during sexual intercourse, and increased risk of urinary tract infection are some of the aftermath of vaginal dryness. But I'll talk about the management, which is non-hormonal and also the hormonal, because the hormonal is a bit different. So in terms of management, you can use over-the-counter, you have oil-based lubricants, you have water-based lubricants, you have plant-based lubricants, which you can get over the counter. The oil-based lubricants are more effective than the water-based lubricants, but also if your partner is using a condom, then a water-based lubricant is better for the woman to use because the oil-based lubricant will reduce the efficiency of the condom. And it's just like putting cream on any part of your body. It's just applying the lubricant down below. But as a general principle, good vaginal health is important. So that means not overwashing down below, using non-biological washing powder to wash your clothes, avoiding panty liners that are perfumed, and those are little things that you can do. Wearing cotton underpants as well can just help the general well-being of down below. But there's a type of HRT which is not tablet form, it's just topical, which is just again like a cream. So it comes as a cream, it comes as a ring, pessary, or a gel that is just applied down below. And this is safe to use. If you have a woman, I'll just use an analogy, who is using topical HRT every day for a year, it's equivalent to a woman who's just taking one tablet of HRT in the whole year. So it's actually safe to use. But then again, we need to work with a woman's preference. So like I said, there are the lubricants that we've talked about. There's topical HRT. Your general practitioner, your family physician is the first port of call. Based on your history, we can almost certainly say that, and other symptoms that you come with, we can say that this is what is happening. We don't necessarily need to examine you, but also again, if there are some things that we consider as red flag symptoms, then it might be better and safer just to examine the woman. And if there are concerns that this is more than menopause, or if even then we refer to a gynecologist, or if the treatment that we've given to the woman as a general practitioner or a family physician, the treatment options we've discussed are not helpful, then we refer again to a specialist. So that's why there's always need to keep on engaging, coming back for follow-up, and just reviewing how you are doing with whatever choice of treatment you are going with as a woman.
Well, thank you. I think that's very helpful that you've shared with us that there are different types of lubricants, obviously, that women can use, and depending on the gravity, I would say, of the symptom, the doctors again are best placed to advise and provide the needed treatment. And I know this is a very sensitive topic and symptom, and I would just like to maybe understand when you talk about vaginal dryness. I understand that women, maybe certain women, particularly very shy around this topic, and maybe just because of the stigma or the criticisms that they associated with it. And I know that there is a devastating impact on relationships, right? If this is not well taken care of, and just the general well-being of the family, of couples as a whole. So in your practice, can you share with us, do you have a real life example specifically where your support has helped improve the mental, maybe an emotional well-being of your patients and their spouses when it came to this topic of vaginal dryness?
Yes, so thank you. One example comes readily to mind, and this happened while I was practicing in Qatar. So I had this lady in her 50s who came and she asked if she could come with her husband. I don't have any problems with patients coming with a family member, especially if they ask and they're comfortable with that family member to accompany them for the consultation. So she came with her husband and she came simply for her medication review. So reviewed her medication, everything was fine, and it was supposed to be a short, straightforward consultation. And I thought that was the end of it. But then her husband started and talked about, oh, his wife is experiencing some discomfort down below. And I think because the husband started the conversation and he found that I was engaging with them, she was confident enough to share her symptoms. And basically, all she was experiencing was vaginal dryness, which was obviously impacting on their interaction sexually as a couple. And I think for me, what was so encouraging was just the look on both their faces when they found out that, oh, so this is what is happening. And so there is help for this. So I think just the education, the empowerment it gave them, and obviously signposting them in terms of management just made a huge difference to them as a couple and hopefully to their marriage, but also to the woman as well. So it's yes, it can be a bit tricky to discuss it, but there's help. And I think like when we keep on saying there is no need to suffer in silence, and even encouraging. It's important for women to if they have that kind of relationship, hopefully with their spouse, to involve them in their menopause journey, because it also makes a difference. It takes off a lot of stress from the woman if she knows that her spouse understands what she's going through and they're on the journey together, if I can put it that way. So that made a big difference to that couple, to their marriage, and to the woman's health overall.
Thank you. I think that's a very beautiful example that you've shared, and I believe our women can benefit from just hearing you share that example. And, I think it's okay if we women ask our husbands to come along to the hospitals with us. I mean, if they're able to do that, whether because of challenges at work or what have you, but if they are able to, I think it would be a good idea to not just even have them come to the hospitals with us on our, health journeys, but just have them be part of that journey, to be honest with you, because I feel like your ability to provide perspective and support for this couple that you just spoke about enhance their relationship. And I think it's helpful for women to understand that we can have these conversations. We can have these conversations with our spouses. We can have these conversations with our doctors. We can talk about it. That's why they're there. They're there to help us. And I'm happy that you've shared that example in a way that, it had a productive and happy ending, knowing that they could just, explore certain medications to support their journey or the symptom that the woman had. And it just reminds me of the fact personally when, I was having babies and, my husband, typically where we come from, they don't allow men into the to the labor room or delivery room, but on this occasion, he was allowed in, and it changed his perspective completely about what we women go through when we give birth to children. So I think just engaging and allowing our spouses to walk our journey, our medical journey with us, I think it's a game changer, honestly, and it just helps ease and make the relationship better. So I hope this has been helpful to maybe women listening in on the call to engage, partner with your spouses on your journey. I believe it's vice versa. But anyway, on the topic of menopause, I think it's important that we involve our spouses on our journey. So thank you so much for sharing, I would say, beautiful example. So we've talked about HRT, and you've also, helped us walk through the non-hormonal treatments as well. You did that earlier. Are there any other ways by which women can manage menopausal changes aside the HRT and non-hormonal treatments?
Yes, thank you. Like you said, also, whether you go down HRT or non-HRT route, this is standard for every woman going through menopause. That's diet and lifestyle changes, diet and exercise. Diet, we've talked about it. The previous presenter you had a good, wonderful 2 sessions on diet and the impact it has on HRT. So basically Mediterranean diet, getting good adequate hydration, that's important. But exercise, I'll zone in on that. So exercise, World Health Organization advises that we should be doing at least 150 minutes of moderate exercise every week. Specifically for women in menopause, weight-bearing exercise is essential. That means the exercise that we're doing when we are standing against gravity. So something like walking, something like running, they're very important. But also in not only doing cardiovascular exercise like walking or running, but also building in strength and resistance and balance into your exercise. So just on an average is at least twice in a week, you should be doing strength exercise, resistant exercise, because you are building up muscle. Muscle mass is what we lose, part of what we lose during menopause. And also, obviously, we talked about predisposition to osteoporosis, the bone thinning out. So when we're building muscles, we're doing strength and resistant exercises, we're increasing our muscle buildup. It reduces and slows down also the rate of osteoporosis, and it also provides support for the joints. So it's very important for exercise, diet, but also stress, management of stress. Whatever a woman knows to do that would help with managing her stress, I think it's important to incorporate this to your day-to-day lifestyle. Whatever helps in managing stress, talking to people, exercise in itself is also a management for stress. Sleep hygiene is also important because sometimes, like we talked about earlier, hot flushes, night sweats. So something to do is to avoid exercise close to bedtime. Have like a routine, a time that you know that I'm going to sleep. Let's just say hypothetically, you're going to sleep at 10 p.m. Now you begin to wind down leading up to that time. Avoid things that might cause stimulation, maybe caffeine or tea or anything that might, and just wind down in terms of even your screen time as well, so that you know that you're already slowed down when you're about to go to sleep. Also, in terms of food triggers, certain food triggers hot flushes in women, and it's knowing what triggers them for you. If that's the case, it's not that this happens to every woman, and avoiding them. So some of the typical triggers are caffeine, spicy food, and alcohol. So staying clear of this if that's the case. Just to go in a little bit about other forms of management. So we talked, like you said, you've talked about it, but I'll just zone in on that is your diet. Things that have phytoestrogen, so food like soya, foods like tofu, fermented foods, because phytoestrogens are plant-based estrogen. So also other things are red clover, which some women find helpful. Other things are evening primrose. Some women get benefit in terms of it helps with hot flushes and it helps with breast tenderness. But also something that we're not taking in or consuming that helps, and there's evidence that shows that this is very helpful, is CBT. So CBT is cognitive behavior therapy. It's a form of talking therapy. It's that helps you to review how you approach how you think of problems and how you manage it. So there's lots of evidence to show that it's very beneficial and helpful for managing hot flushes, but also other symptoms of menopause.
Thank you. I mean, we cannot run away from exercise is basically what I think I would summarize from what you've said. Exercise is really very beneficial. We've talked about it over and over and over again. Try and encourage women to adapt this form of lifestyle. So it obviously comes with a lot of benefits from what I hear you say. But specifically, I think the key now is what type of exercise, because that's really what is important at this point as we transition or we're, undergoing menopause. And I hear you say we should really zoom in or focus on strength and resistance exercises. And why do we do this? Because we help build our muscle mass. Obviously, the body is losing estrogen, progesterone is depleting, and the muscle mass obviously is wearing out. So the more we do these exercises, the more we build our muscle mass, the more we have good bone health, is what I'm hearing you say. And typically, exercise also secretes hormones, right? So in a sense, I think we're helping the body go through the process of menopause in the most effective way. And I think the more active we are, the better we're able to manage the symptoms. You've also talked about sleep hygiene, and you've indicated that, we try as much as possible to avoid food triggers, caffeine, spicy food, drinking alcohol. And you've also indicated certain things that may be helpful, red clover, soy products, and obviously the cognitive behavioral therapy, which helps manage symptoms like hot flushes and mood swings. So I think this is important to call out. Yes, we're talking about treatment options, but we need to understand that there are also lifestyle changes that are really very helpful for both the emotional, psychological, and physical symptoms that we may be undergoing as women. And I think that's absolutely a game changer when we try and incorporate all these helpful tips that you've shared with us today. So on the final notes, and I'm sure you're like, okay, finally we get to stop talking, but I've enjoyed the conversation so far. So on the final note, what advice do you have for women on our podcast today with varying needs and sometimes maybe not so good healthcare access in their region or where they live? I know sometimes we take it for granted that the healthcare access is just a normal thing. It may not be so for most or some of our women on the call. So how would you advise that they manage this menopausal period or journey in their lives? I mean, given the limited access to healthcare and obviously different needs as we are living in our society today.
Thank you. I think the important take-home message is there is no reason, there's no need to suffer in silence. That's one take-home message. Listening to podcasts like this, the previous podcast sessions that you had on menopause are all ways that we can empower ourselves and educate ourselves. And also sometimes what a woman needs to know is, oh, so this is what is happening. Like we said, not every woman would have symptoms that they need management for. So just education is powerful. So listening to podcasts like this. Also, there are also very helpful websites that you can get lots of free information on, such as Rock My Menopause, Daisy Foundation, Menopause Matters. Also, you get certain apps that come that are specifically geared towards menopause, and they have some free aspects of them that could be beneficial. But I think importantly is also lifestyle. You don't need a doctor for lifestyle changes. We've talked about exercise, we've talked about diet, we've talked about stress and sleep management, we've talked about sleep. Some of these things we can only do by ourselves, but also having a community is part of lifestyle. Having a good community, be it maybe your spouse or your sisters virtually like this, or sisters from biological or not biological sisters or friends, just being able to know you should be free to talk about this and there's help there. I think that's the one take-home message. I think hopefully that women would go home with after listening to this session. Whether you have ready access to medical care or not, there is help. But however, if you've tried different things like we've suggested and there's still no change or things are getting worse, then please seek medical help when you can.
Please seek medical care when you can. And thank you so much for just bringing it home. We don't need to feel intimidated with the trend or what's going on social media. And it's maybe just being aware, it's all we need. We may be blessed in such a way that we're not really going through the symptoms in a way that is impacting our day to day. And that's a good thing. But just also being aware that this is something that we need to pay attention to, so that when we note those symptoms or signs, then we can like, okay, maybe this is what is happening. And also, I think you talked about community, and I think as women, our community starts first from our homes. But just being able to have those conversations with our family, our spouses, to help them understand that we're in this phase, so that it's probably eases the friction that may typically occur if people don't really understand why we're moody, or we're acting in certain ways. If that's a symptom that resonates with maybe women who are listening in on the call, I think just having that conversation, like you said, just speak up, have the conversation. There's nothing to be shy about. We are women. This is we didn't bring it upon ourselves. This is biology. This is how we are made to function. This is how God designed it. So just having our men understand, our fathers understand, our sons understand, our brothers understand that we're going through this journey, and maybe having them read up also so that they can help us along that journey. I think it makes it a bit much more easier for us to take that part and to manage our treatment situations or options or what have you. So thank you so much, Dr. Tayo, for helping us get to the nitty-gritty, just digging it a bit further to understand what are these symptoms we keep talking about, and more importantly, the effective options or treatment options that we as women can avail ourselves as we speak to our physicians, as we speak to our doctors, based on what works best for us. The explanations have been so helpful personally to me. I will definitely be listening in again to this podcast for my own well-being. So, Dr. Tayo, I've personally learned a lot. If I need to say that, I am saying that now. So thank you once again for sharing. And we're so grateful that you've decided to join us today to have this very crucial conversation.
Thank you. Thank you very much for having me. Thank you. You're doing a great job for me, Kay. Thank you.
No, thank you for joining us and just helping us demystify, all those myths and issues. And I think, like you said, we need a community. This is a community where women can lean in and empower not just themselves, but others. So, dear listeners, please feel free to share this podcast with your relatives, with your friends, with your loved ones as well. I mean, education is empowerment in itself. And please remember that the best treatment plan is one that is tailored to your individual needs and health profile, not what your friend said. Please always discuss your options. I think it is really helpful to call this out again and again. Always discuss your treatment options or whatever conditions you're going through with a healthcare provider or medical doctor to determine the most suitable approach for you. Thank you so much for tuning in to our podcast episode today. I hope it has been extremely helpful. Don't forget to subscribe, and please, once again, remember to share with your friends, your sisters, your daughters, your husbands, your sons, and even your fathers. Like I said, it makes the whole journey much easier when we do so. So keep listening to the Help We Need podcast. Stay tuned in for more episodes on living your best lives. And until next time, stay empowered and remember to empower her.